In the midst of Heart Health Month, we head to St. Vincent Healthcare to check out an exercise program catered specifically toward heart recovery.
Tonight, Q2's Jenny Fix checks in with a familiar face to find out if cardiac rehab could potentially benefit you.
Patient regains strength and gets back to mobility. So there's the recovery immediately after surgery, and then after that there's an important period of recovery called cardiac rehab, and that spans about a 3-month period of time where patients get supervised exercise. They also get information regarding their diet and healthy living.
Kind of get them back into it right after surgery, and then after they graduate from that program, then they can come over and continue exercising and medical exercise under supervision.
This is where I come several times a week and meet with my friends and do some exercise.
Following a heart attack, our own Ed McIntosh started off at cardiac rehab, and he can now be found at medical exercise.
I have to admit that when I got started with it, it was like I knew I had to go do my time, and I said, okay, I'll go to cardiac rehab and I'll go 2 or 3 times a week. I get through it, and then it's like, okay, my sentence is over and I can cut free. And once I started with the program, I actually wanted to come more often.
The supervision and atmosphere allow patients to recover at their own pace and without judgment.
And you see everything from stroke victims who are relearning how to walk to people who are just trying to make the best of the life that they have in the years they have remaining.
They help me set goals. I'm very goal-oriented, and they'll say, do till fatigue. I'm like, no, give me numbers. I want goals. I want to achieve and go beyond the goals, and they're very good at keeping those just out of reach.
Outpatient rehab is more than just healing the body. It's also therapeutic on an emotional level.
The camaraderie here is really special. The people are really nice. A lot of joking, a lot of kidding, a lot of fun. They make it fun. I asked Ed one time, why do you come here? You could probably go to any gym. He said, I like the atmosphere, there's no competition, and the people are inspiring, and that's right on the money.
Folks that are coming here are not people that are going to go to a regular gym. They're people that have been coming through some sort of a life-changing medical event. Maybe they're just getting older, watching them overcome some major life obstacles, and it's just a great reason to keep coming back.
Many patients have been coming for decades. Medical exercise is something that they can continue for life.
We're not getting any younger, we're all getting older, and we just have to take care of ourselves. And it's a choice, it's a conscious decision you have to make to lead that kind of lifestyle. It's not easy. If it was easy, everyone would do it. But if you make it a habit and you make it with purpose, I think you'd have a better outcome.
In Billings, Jenny Fick, MTN News.
And to learn more about whether you could be referred to the medical exercise program, you can contact your physician.
Now from there, you would meet with an exercise specialist to build your individual program.